My name is Richard Harris. I'm a vascular and endovascular surgeon here at the Sydney Adventist Hospital. An aortic aneurysm is a blowout in the main artery going through the abdomen. And usually these aneurysms occur below where the kidney arteries come off. And once an aneurysm, or once the enlargement in an aorta has reached beyond about 5 centimetres, that becomes a risk to the patient's life because that artery can rupture and the patient has a very high chance of dying if a rupture occurs. Fortunately, these days, many people are picked up with imaging or screening, usually with ultrasound for other things like gallbladders and kidneys, and an aneurysm is found. And it's a very common occurrence in men and women over the age of 70 years of age, and should be thought of and looked for in many people over that age. When it's found, it can be either monitored below that 5 centimetre mark for several years sometimes, but once it hits that mark, we can repair that now with a very minimally invasive procedure. And that was done through an enormous cut from the sternum all the way to the pelvis. The abdomen was opened, the aneurysm sac was dissected out, and a graft was actually sewn in to the top and bottom of the aneurysm, and the abdomen closed. And that patient spent a week or two in hospital recovering from that procedure. These days it's done through little punctures in the groin on both sides. A stent graft is put up inside the aorta and secured inside the aorta, and that directs flow away from the aneurysm through the stent and back into the normal arteries further down. And that then protects the patient for the rest of their life from that aneurysm rupturing. The mortality rate from this procedure is lower than the open procedure, and we're talking about close to a zero mortality from that operation, compared to about 2 or 3% from the larger old-fashioned open operation. So it was a very, very serious operation because some people didn't survive even the elective repair of aneurysms. These days, your chance of going home in 2 days is 99.9% after a endovascular repair of an aortic aneurysm. And you're likely to get back to work in a week or two after that repair, and back to your golf and your normal lifestyle very quickly after an endovascular repair.